Good morning, students. Today's class is about OGTT, Oral Glucose Tolerance Test. Now, as the name suggests, Oral Glucose Tolerance Test. So, this test is something related to glucose metabolism, or in turn you can say about diabetes mellitus. Now, there is a wonderful test that is available in the market, that is blood glucose or plasma glucose or serum glucose, whatever you may say, but the actual term is plasma glucose test, is used widely for the management as well as diagnosis of diabetes mellitus. And there is commercially available kits also for diabetic patients for self-monitoring of the blood sugar level in the home also. So when there is a very wonderful test such as blood glucose level monitoring is that there in the market, so why are another test is needed here like oral glucose tolerance test? Now here lies the aim of oral glucose tolerance test. Now you can say that which is the main hormone or the only hormone of our body that is responsible for the lowering of the blood glucose level, that is the insulin hormone. And from where it comes? It comes from the beta cells of pancreatic islets. So if you have adequate beta cell function or adequate number of beta cells, that is functioning beta cells in your body, then there will be adequate amount of insulin secretion in your body. So then you can able to handle your glucose load in your body. So the blood glucose level will be normal in your body. So the functional capability of beta cell of pancreas is very important thing in the diabetes mellitus. And here lies the importance of OGTT, oral glucose tolerance test. It is a test which is used for the as a index of the beta cell function of human body. Now you can say that beta cell secretes insulin, so you can measure the insulin level in serum, and it is also a index of the beta cell function. But serum insulin is not an adequate index of the beta cell function, as it is written in the slide number 2 that the insulin secretion is stimulus dependent, number 1 point. And the number 2 point is glucose is the most physiological stimulus for the insulin secretion. And the glucose level in the body varies very widely, so the circulating insulin level. Now, let me explain this 2 point to you clearly. Now, suppose you are a person with a adequate functional beta cell reserve in your body, but you are put in a carbohydrate restricted diet, or you are starving. Then what happens? The blood sugar level in your body is also low. Then the circulating serum insulin level will also be low in your body. But you next day go to your friend's birthday celebration, and there is cakes, chocolate, pastries and other things, many more things in the birthday celebration party, and you ate it, and thereafter the blood glucose level will be higher in your body. So the serum insulin level will also be high in your body to counteract the blood glucose level. And thereafter what happens? Your blood glucose level will be lowered to a normal level. So you are a person with normal functional reserve, but these two occasions your serum insulin level will be different. So the serum insulin is not an adequate index for the beta cell functional reserve check. So the beta cell functional indices are again of two types. First of all, you can say beta cell response to non-glucose insulin secretagogues, and number 2, beta cell response to glucose. Now beta cell response to glucose can be assessed by two methods, IV glucose administration as well as oral glucose administration. Now this oral glucose administration test is called the oral glucose tolerance test. Now coming to the next slide, slide number 3, that is the indication of OGTT. So far from the discussion, it is clear that the first indication of the OGTT test is to assess the beta cell function for better understanding of the diabetes mellitus. Now number 2 point is diagnosis of gestational diabetes. Now what is gestational diabetes? Gestational diabetes is a condition when in a pregnant woman, after she conceives, the patient becomes diabetic. But after the termination of the pregnancy or the delivery of the baby, the patient becomes absolutely normal, but the patient is pre-diabetic for lifelong, and in the latter stage of his life, her life, she will definitely develop diabetes. As well as diabetes is a chief cause for pregnancy related complications. There will be complication for mother and complication of baby also. For this reason, you have to diagnose and treat this gestational diabetes timely. For this reason, you have to diagnose it timely. So, this is again one indication of OGTT for diagnosis of gestational diabetes mellitus. Now, number 3 indication. This is the diagnosis of diabetes as per American Diabetic Association recommendation 2013. Number 4. Epidemiological data collection. Now, this is again research purpose for the community medicine peoples. When you will go to the community medicine classes, you will later understand it clearly. But for this time being, just remember the epidemiological data collection is needed. For this reason, OGTT is also needed. Now, these are the 4 indications of OGTT. Now, coming to the next slide, that's the 4th slide, patient preparation. This is the proper OGTT test. Now, patient preparation. Now, you know that before any test, you have to prepare the patient for that day, that is the D-day. Now, what are the patient preparations here that is needed? First of all, the test is done after 3 days of unrestricted carbohydrate diet. Now, what does it mean by the unrestricted carbohydrate diet? That is more than 150 grams of carbohydrate daily. You have to consume for 3 days, and thereafter on the 4th day, you are asked to test the OGTT. Now, number 2 point is normal daily physical activity prior for 3 days. Number 3 point, carbohydrate rich meal on the night before the test. Number 4, discontinuation of medication affecting the blood glucose levels. There are some medication which can affect the blood glucose level. Actually, they can raise the blood glucose level, like glucocorticoids or steroids. This can rise the blood glucose level. Or thiazide antihypertensives. These are some drugs. They can raise the blood glucose level of a person. So, you have to discontinue these sorts of medicines. Now, coming to the next point, that is point number 5, overnight fasting for 8 to 14 hours. Here only sips of plain water may be allowed only. And number 6 point is no smoking. Now coming to the next slide, that is the test proper. On the day of the test, first point, patient should attend laboratory after overnight fasting. Here remember one thing, the patient will say to you that, doctor, I have only taken black tea. No tea is allowed. Even with no sugar, no milk, no tea will be allowed. Patients should take only sips of water, plain water. Now, number 2 point, test should begin between 7 am to 9 am in the morning. Number 3, comfortably seated. Patient should be comfortably seated. And number 4 point, fasting blood and fasting urine samples are collected and marked as 0-hour sample. Now, 75 grams of anhydrous glucose dissolved in 250 to 300 ml of water to be swallowed over a period of 5 minutes. Every point is very important. 75 grams of anhydrous glucose, not only glucose, anhydrous glucose, and to be dissolved in 250 to 300 ml of water. 250 to 300 ml of water. And that to be swallowed over a period of 5 minutes. Why 5 minutes? Because you are giving raw glucose syrup to a patient who is overnight fasting, who is in an overnight fasting condition. It is very much nauseating condition is created here. So the patient feels nausea. So you have to ask him or her to swallow it over a period of 5 minutes so that the nausea will be less. If the patient vomits, then abort the test. Ask him or her to come on the next day and perform the test. Now in case of children, 1.75 gram of glucose per kg of body weight is given in a similar volume of water, that is 1:4 dilution. 75 gram anhydrous glucose in 300 ml of water. And in case of children, 1.75 gram per kg body weight glucose in a water, 1:4 dilution should be followed strictly. Now coming to the next slide. the test proper is continuing. Here, OGTT can be done by two methods presently. First method is classic and original OGTT. This is at first described as OGTT. It is the old method. Here, the blood and urine samples collected at 30 minutes intervals up to 2.5 hours. That is the 2.5 hours. So, total 6 samples of each urine and 6 samples of blood is collected. But it's a cumbersome procedures and later found that there is no extra added benefit for patient management. For this reason, WHO make it simple. And for this reason, they asked to test the OGTT in a modern format. Which is the modern format? Here only fasting samples are collected and 2 hours after the sample is collected. Both urine as well as the blood. Now one thing, from where the 2 hours have to be counted? From the starting of the glucose drink or the end of the glucose drink? It is from the starting of the glucose drink. The 2 hour sample is collected. Now coming to the plasma glucose value interpretations in milligram per dl. Now you have to learn this chart by heart. Now the fasting value in a normal condition or the normal patient, it should be less than 110 or less than 100, whichever you may say, milligram per dl. And in case of a diabetes mellitus patient, the fasting blood glucose value or fasting plasma glucose value will be greater than 126 milligram per dl. But what is the in-between values? The in-between values is between 110 to 125 or 100 to 125 milligram per dl value. This is impaired glucose tolerance test value. This is termed as IFPG, impaired fasting plasma glucose. Impaired fasting plasma glucose. And coming to the third row, that is the 2 hour value. Here the normal patient, in a normal patient, the 2 hour value will be less than 140 milligram per dl. And in case of diabetes mellitus, it will be more than 200 milligram per dl. And the in-between value is impaired postprandial plasma glucose value, that is from the 141 to 199 milligram per dl. Now, here I have mentioned the 1 hour value also. This is observed in a case of old or classical OGTT where you are taking the 1 hour value also. This in case of a normal person should be less than 160 milligram per dl. But the other diabetes mellitus and impaired glucose tolerance test value is not fixed. Now coming to the next slide, that is the graphical demonstration of the values. You have to learn this graph by heart, practice it in your home. You have to draw it in your exam. Now this is the chart. Now coming to the next slide, that is the contraindication of OGTT. First of all is diagnosed diabetes mellitus. If a diabetes mellitus is diagnosed already, what is the point of doing a OGTT? The patient is diseased and the patient have low functional beta cell reserve, so there is no need of any OGTT. And in case of follow-up of diabetes, same thing applies. Now next contraindication is acutely ill patient. Now why in case of acutely ill patient it is contraindicated? Because in acutely ill patient, all the stress hormones are acting and all the stress hormones are diabetogenic. They can increase the blood glucose level. For this reason, the OGTT is contraindicated here. Now, the factors affecting OGTT is the next slide. Factors affecting OGTT. First of all, smoking. Nicotine may higher the blood glucose level. Number 2, stress, infection, acute illness. You all know these are the conditions giving rise to high stress hormone level. For this reason, there will be prolonged elevated curve in OGTT due to the effects of stress hormones. Number 3, insulin level. It is very obvious that insulin level affects the OGTT values. Now, number 4 is exercise and number 5 is liver disease. Now, you all know that the liver as well as skeletal muscles play important role in the glucose metabolism. For this reason, liver disease as well as strenuous muscular exercises can affect the OGTT levels. Now next point is thyroid disorders. The thyroid disorders can influence the OGTT curve because thyroid hormones affects the glucose metabolism by various ways. Later you will learn. Now what happens in case of hyperthyroidism, there will be steep rise of curve, and in case of the hypothyroidism, there will be flat OGTT curve. Now I am going to the next slide, the urine glucose value. So far we discussed about the plasma glucose values. Now what will be the urine glucose values? Remember, no sample, that is maybe it 0 hour sample or 2 hour sample, no sample should contain glucose in a healthy person. Why? Because renal threshold of glucose is 180 mg per dl. So after 180 mg per dl blood value, the glucose reaches this blood value. Thereafter the glucose start to rise in the urine. But all the normal values, in case of a normal person, all the blood values should remain below this 180 mg per dl. So no normal person excretes urine in health. Now, what is the method of glucose estimation in blood and urine in case of OGTT? It is the Gott-Pod method, glucose oxidase and peroxidase method. Both urine and blood are tested by this method. Now I am going to the next slide, that is some special points about the interpretation of the OGTT curve. Now, first of all is elementary glycosuria. Here the fasting and 2 hour PP glucose value are normal, but there are exaggerated rise of plasma glucose following ingestion of the glucose. That is, here the cause is increased absorption of the glucose from the gut, that is gastrointestinal tract. Why? Here when we take the meal, then the glucose will be absorbed rapidly from the gut. Thereafter the insulin level also rises and counteract this glucose value. In between the timing, that is the glucose absorption from the gut and the insulin level starts to rise, in between this timing there will be high value in the OGTT curve. This is the elementary glycosuria. Actually the cause is increased absorption from the glucose from the gut. The next special point is renal glycosuria. Here what happens? Lowering of the renal threshold below 180 mg per dl of plasma glucose value. So there is a glucose in the urine in an absolutely normal person, the person with normal plasma glucose value. When it occurs? It occurs physiologically in the 3rd trimester of pregnancy and in diseased condition, Fanconi's anemia, abnormal SGLT2 transporter in the renal tubules. Here what happens? In Fanconi's anemia and abnormal SGLT2 transporters in the renal tubules, here the reabsorption of glucose in tubules are defective. For this reason, the glucose is easily filtered by the kidney and it appears into the urine. This condition is called the renal glycosuria. Next point is the conditions where there is increased renal threshold, that is just opposite of the renal glycosuria. Here the renal threshold is increased. Now the conditions where increased renal threshold, here low GFR and normal tubular reabsorption occurs. So glucose does not appear in urine even if the plasma sugar level is more than 180 mg per dl. Actually this is a condition just opposite to renal glycosuria. Here the renal threshold is increased. Now what are the causes? First of all, the cause is atherosclerosis and the second cause is diabetic nephrosclerosis. Now what is diabetic nephrosclerosis? The diabetic nephrosclerosis is, as a complication of diabetes, the renal changes occurs and all the renal changes, the pathological changes in kidney in diabetes is collectively cause the renal nephrosclerosis. Here the renal threshold is increased. Now the next slide is OGTT in GDM. The full form of GDM is gestational diabetes mellitus. Now OGTT in GDM is done as per DIPSI guidelines in India. What's the full form of DIPSI? It is very important. The full form of DIPSI is Diabetes in Pregnancy Study Group in India. Now here the procedure is 75 grams of anhydrous glucose to be taken with 250 to 300 ml of water. and 2 hours after the sample is taken and tested. Now what is the sample? The sample is mother's blood, and the timing of test, it is 24 to 28 weeks of gestation. Now what is the finding? If the 2 hours after the glucose meal, the plasma glucose level is more than 140 mg per dl, the gestational diabetes is suspected in that patient. Now remember this DIPSI guideline by heart. You may find in Google many other guidelines that is available internationally, but these are different from DIPSI guidelines. Don't mix the DIPSI guideline with them, because it is practiced widely in India and you are supposed to appear first professional MBBS exam in India, not in UK, not in US. So don't mix up their guidelines with DIPSI guideline. So learn by heart this DIPSI guideline only in India. Now this is so far about OGTT. Hope it's clear to you. Now thank you for your kind attention.